Welcome. In this video, we'll learn about different types of sources for your clinical question. We'll talk about background versus foreground sources, different types of studies and other sources, the AOA's clinical practice guidelines, and what types of studies are best suited for answering different types of clinical questions. This part essentially adds the TT to your PICO question for types of questions and types of articles. We sometimes need general information about a condition, a disease, or a treatment to help answer our clinical questions. This is background information that you would find in medical textbooks, point of care tools, or reviews. So you'll find overviews of information that have been compiled from existing evidence at the time they were written. However, they're not going to provide you with the latest research on the topic. An example of a question you might answer by looking in a background source is what causes digital eye strain? Foreground sources are the research studies that you'll use for evidence when answering your clinical question, such as, is there evidence that applying the 20-20-20 rule reduces digital eye strain? You would need to look at research studies in databases like PubMed to find the answer to this question. For our other clinical question, we might find common treatments for dry eye in a background source, and then look at our foreground sources or research studies to find out the current evidence for how effective omega-3 fatty acids are for reducing dry eye. You can access the relevant background sources by going to the Optometry Resources Guide and clicking the Background Sources page. You can click the Evidence-Based Optometry page and look under Find where to look for evidence. Make sure to use these links to the databases as opposed to Googling these databases on their own. These links are what provide you access as a Pacific student. Will's Eye Manual is an example of a background source. Here we're looking for information about digital eye strain and found a section on ocular pain. UpToDate is a point of care source and is used by medical professionals to quickly access information about a specific condition and see recommended treatments and other information. Clinical Key is another excellent source. It provides research studies, but also has a lot of background sources. In this example, I searched for osthenopia and then limited my results to books, since books would probably provide general overviews. I found this chapter excerpt about osthenopia, and I clicked Control F. On a Mac, you would click Command F and searched for the word digital. I found where it mentions digital eye strain in this chapter. Last of all is Access Medicine, which has many medical textbooks among other useful resources. I searched for dry eye and found this section on ocular pharmacology in the book Goodman and Gilman's The Pharmacological Basis of Therapeutics. It discusses treatments for dry eye and corneal edema. During this course, you'll become familiar with the AOA's clinical practice guidelines and the evidence they're based upon. However, we'll look at foreground resources to look at and how to look at the latest evidence yourself. The AOA's clinical practice guidelines offer a grading system for evidence. Generally, studies with strong designs are grade A. However, remember that the quality of the study is only as good as its design. So while meta-analyses are generally a grade A, since it's doing a statistical analysis of the results of many other studies, if it's poorly designed or if the studies it analyzes were poorly designed, the quality of the meta-analysis will be very low. So while it's important to understand these grades of evidence, remember to always think critically about the study designs themselves. Here are simple definitions of types of studies that you can find on the evidence-based optometry page. So how do you know you're looking at a study? It will have certain sections. So you'll have an abstract or a summary of the study, and the abstract will include its results. It will have an introduction, which includes a review of the existing literature and how the current study adds to the existing literature, a method section explaining how the study was designed and the study's results, a discussion of the study's results and their implications, and a list of references. If you see these sections, you can expect that it's a study. If you don't see these sections, you can expect it's a review or another type of article. There are different types of clinical questions. For example, a therapy question asks about the effects of an intervention on certain patient outcomes. This type of question is best answered by a randomized controlled trial. This is because it's a trial which participants are randomly assigned to two or more groups. At least one, the experimental group, receiving an intervention that's being tested, and another, the comparison or control group, receiving an alternative treatment or placebo. However, if there's a systematic review or meta-analysis available that combines the results of many other randomized controlled trials, that would be even stronger evidence. However, other clinical questions cannot be answered by randomized controlled trials because it would be impossible or unethical, and so other study designs are preferred. For example, to find out whether a potentially harmful exposure may cause a certain disease, we would prefer a case control study or a cohort study because it would be unethical to expose patients to potentially harmful agents. A case control study examines a group of people who have experienced an event, usually an adverse event, and a group of people who have not experienced the same event, and looks at how exposure or to these suspect agents differed between the two groups. So in our first question, it's a therapy question, and we're ideally looking for a meta-analysis, a systematic review, or a randomized controlled trial. Our second question is also a therapy question, and we're looking for these same types of studies. For these study types, we can think of them as either primary or original research, meaning single research studies, or as secondary studies that review or combine existing research. Among primary study designs, there are experimental studies and observational studies. Experimental studies are those that use an intervention. Observational studies are those where no intervention is made. Secondary studies or reviews of research can be either studies such as meta-analyses or systematic reviews that gather existing research in a systematic way, and in the case of meta-analyses, perform a statistical analysis on the pooled results. So they are studies in and of themselves as well. Practice guidelines such as AOA's clinical practice guidelines review existing evidence and make guidelines for patient care. And those are not designed as studies. So here we can see the synthesized evidence that synthesized evidence is at the highest level of evidence, whereas experimental studies are lower and then observational studies are at the bottom. Notice the animal studies are below that, and they're actually not listed as evidence grades in the AOA's clinical practice guidelines. So a meta-analysis is a statistical technique that summarizes the results of several studies in a single weighted estimate, in which more weight is given to results of studies with more events and sometimes studies of higher quality. A systematic review specifies methods to identify, appraise, and summarize studies addressing a defined question. It can, but need not, involve meta-analysis. So while systematic reviews and meta-analyses are synthesized evidence, they are also studies in themselves because they have a particular design and are laid out like a research study with methods, results, and discussion sections. We've already talked about randomized controlled trials. Diagnostic studies evaluate a test for diagnosing a disease. Cohort studies are non-experimental study designs and follow a group of people or a cohort and then look at how events differ among people within the group. So they go from a point in time into the future. We already mentioned case control studies. These study designs look at how past exposure or lack of exposure to an agent and then the difference in patient-important outcomes between these two groups. So this is starting back in time with the exposure or lack of exposure and then looking forward in time to patient outcomes. Non-randomized trials are when the treatment was assigned by a method other than random allocation. Cross-sectional studies are a weak study design. They're grade D, and they involve surveying a population about an exposure, a condition, or both at one point in time. They can be used for assessing the prevalence of a condition in the population, but they should never be used for assessing the causality or treatment. Finally, case reports or case series are analysis of a series of people with a disease when there's no comparison, and they're also a low level of evidence. Reviews are not study designs at all. They review existing literature on a topic and provide an overview, and they can be great background sources. So while they reference a lot of existing literature on a topic, the literature they review was not selected using a methodology, as it is in a systematic review or a meta-analysis. So you cannot trust that it includes all of the relevant literature on a topic. It's up to the author's discretion to select the literature, and so that selection may be biased. However, again, they can be good background sources. So they're generally published in peer-reviewed journals, and while they should be just used as background sources, they have They usually have been reviewed by other experts in the field before they were published. Finally, you'll find professional articles. These are articles in professional magazines written by other professionals in your field that provide best practices, news, editorials, their own experience, and information about new products. These are not studies or evidence. Professional magazines are also generally not peer-reviewed, but rather they just have editors. So while they can help you stay current, do not use information from these sources to make decisions for your patient care. Gray literature or non-published sources that might also be useful for you. These would generally be of interest to you if you were doing your own systematic review or meta-analysis and wanted to make sure that you included all of the relevant literature on a topic. They're generally not where you'll look for evidence for patient care. Some examples of gray literature might be clinical trials that were registered with clinicaltrials.gov but were not published. Another example might be dissertations. You might also find conference proceedings. These can be useful, but not all conference presentations get published in peer-reviewed journals, and so you'll just want to remember that when reading over them. Finally, we'll say a word about predatory publishing. This is important in case you publish your own work. Essentially, predatory publishers are journal publishers who use bad practices that harm authors and the quality of work in general. They may charge fees for publishing your work. They may have a very rapid timeline between when you submit your work and when it's published, leaving little time for quality peer review. They also may have no intention to archive the content they publish in perpetuity, and so your work may be lost. After all the work you put into your paper, you definitely don't want to deal with a publisher who doesn't provide good peer review, or who may disappear in the future. So here are some tips for checking out a journal before you decide to publish in it. Here are some red flags, and you can also look at these whitelists for good quality journals. So now that we've learned about different types of sources available to help us answer our clinical questions, we'll learn how to find them in the next video. Remember to contact me or the library, help options with any questions, or to work on any steps of your research process.